Right. At the beginning of the meeting, all attendees will be muted and will remain muted in the question and answer period. After the presentation has concluded, we will proceed to the question and answer period. Please submit questions by one of the following methods. Raise your hand on the Zoom feature or type the question in the Q&A box at the bottom of your screen. Raise your hand by pressing *9 on the phone feature. We ask that you keep your questions as specific as possible and relevant to the topic. Note that we will only be responding to relevant questions. We ask that you be mindful of time and speak for no more than 2 minutes. This time may be adjusted based on the number of questions received. Staff will enable speaking at the appropriate time. And lastly, the meeting will end promptly at 7 p.m. At 12 p.m. For any additional comments or questions, please visit the Smoke-Free Santa Clara webpage. And we will now begin our presentation. Advance the next slide. Thank you. So I want to make some introductions of our panelists who are joining us today. So again, I am Jennifer Acuña. I'm a management analyst in the city manager's office with the city of Santa Clara. And I am joined by County of Santa Clara staff, Leslie Sellers, a consultant, and Jennifer Aguilar and Dawn Tran, their Tobacco Free Communities Program staff. So thank you for being here with us. Go to the next slide. Thank you. Tobacco remains the #1 preventable cause of death and disease in California. The Santa Clara County's Healthy Cities program seeks to address tobacco-related health concerns by promoting policies and practices to provide tobacco-free and smoke-free communities. Currently, the city has adopted 6 out of 12 recommended tobacco prevention strategies in the Healthy Cities program, which are focused on reducing exposure to secondhand smoke. Although the city prohibits smoking in multi-unit residences and many outdoor areas, it does not prohibit the sale of flavored tobacco products or require a local tobacco retailer permit. The county has provided funding to cities to support tobacco prevention strategies known to have the highest impact on reducing tobacco-related disparities and inequities. Next slide, please. And so as such, the city is pursuing tobacco policies. And so by way of background, on April 7, 2020, Council authorized execution of a grant agreement with the Santa Clara County Public Health Department to explore tobacco prevention policies that have been shown to reduce youth access and exposure to tobacco products. The city executed the grant agreement on July 20th, 2020, in the amount of $48,944 for fiscal year 2020-21. And we'll go to the next slide. And now I will pass on the presentation to my colleague, Leslie Sellers. Thank you.
Thank you, Jennifer, and thank you to everyone for joining us. This is the 3rd forum that we're doing to receive public input on the policies that are being considered by the city of Santa Clara. This forum is specifically geared toward the business community, so we have slightly different content, but some of you may have seen this presentation before. So to provide additional information on the health impacts of tobacco use, in Santa Clara County, 1 in 8 deaths are due to smoking. And in the county, 1 in 10 youth are using tobacco products, including e-cigarettes. According to the US Surgeon General, there is an epidemic of e-cigarette use. There was a 78% increase in high school use of e-cigarettes from year over year. And in Santa Clara County, 1 in 3 teens report trying e-cigarettes. Federal law right now prohibits the sale of candy and fruit flavored cigarettes, but it does not prohibit the sale of menthol tobacco products, including cigarettes and other menthol products. Federal law also doesn't prohibit the sale of other flavored tobacco products, such as flavored cigars, little cigars or cigarillos, smokeless tobacco, hookah, or electronic smoking devices, and the e-liquid that's used to provide the nicotine solution for those devices. So I'm going to give some examples of these products in just a minute. In California, the state legislature did pass a law, SB 793, that would prohibit the sale of most flavored tobacco products with a few exceptions. This law is not currently in effect. The tobacco industry submitted a referendum to put the issue on the ballot to be voted on by voters. It is currently scheduled for the next general election in November 22, and right now the law is being suspended. The state law does allow local governments to adopt stricter local laws, including the ones being considered by the city of Santa Clara. The main policy options being considered by the city are to reduce youth access to tobacco products. So a couple different strategies. One would be prohibiting the sale of flavored tobacco products anywhere in the city, prohibiting the sale of all electronic smoking devices or any of the component parts, and reducing the availability of tobacco by limiting where new tobacco retailers can locate in proximity to schools and to other retailers. It would also prohibit the sale of tobacco products in pharmacies. A little bit of information about flavored tobacco use among youth. 80% of youth who've ever used tobacco started with a flavored product, and youth believe that flavored products are safer and less addictive than non-flavored varieties. What the city is proposing would be a comprehensive ban on the sale of flavored tobacco products, which would include menthol cigarettes. It would apply to all tobacco retailers in the city. There are currently about 65 retailers who sell tobacco in the city of Santa Clara. And there are 7 other laws in communities within Santa Clara County from the cities listed below, as well as the unincorporated areas in Santa Clara County. Here's some examples of the types of flavored tobacco products that would be subject to the law. There would be a prohibition on the sale of menthol cigarettes. You usually see these in green packaging. Newport and Cool are some of the common, most popular brands. Little cigars that are flavored would be prohibited. Swisher Sweets is a common brand that you see of this. You can see different flavors here: pineapple, grape, tropical fusion, strawberry. They're also generally very inexpensive. You can see 2 for 99 cents or 3 for $1. Those would be prohibited. Smokeless tobacco. Skoal is a popular brand. There are some flavored varieties of smokeless tobacco. Here's some examples of cherry and berry flavored. We've gotten a lot of questions about hookah, so I wanted to make clear that the prohibition would include hookah tobacco products. Here are some examples of flavored hookah tobacco. And e-cigarette products. So there are a variety of types of different e-cigarette products, which are devices that use a battery to heat a liquid solution that may or may not contain nicotine, which the user inhales and then creates an aerosol or a vapor, sometimes it's referred to. There are a variety of different models of these. Juul is a popular brand now. They have a rechargeable e-cigarette. It looks more like this little USB device here, kind of to the right of the screen. Those are the nicotine solution pods that you can add to the device. So the prohibition would apply to all e-cigarette products and also the liquid that you use to refill the device. Candy King is a brand that sells e-liquid in various candy flavors here: sour worms or Swedish fish. There are more than 10,000 flavors on the market of e-liquids. The city is also considering a prohibition on the sale of all electronic smoking devices and vaping products. There are 7 other laws like this in Santa Clara County. In California, prior to COVID, the Department of Public Health issued an advisory urging everyone to stop vaping because of the health risks. There were a variety of diseases that people came down with a variety of diseases from e-cigarette use. And most e-cigarettes contain nicotine, which, as we know, is harmful to developing brain and contains other chemicals such as formaldehyde or other carcinogens. The city of Santa Clara is also looking at reducing the availability of tobacco by limiting where new tobacco retailers could locate. So the prohibition would be for a 1,000-foot buffer zone around schools and 500 feet within other retailers. So if you are a retailer who currently exists in one of those areas, you would be able to continue operating as long as you keep your license current. You would be grandfathered. Any new retailers that want to locate within 1,000 feet of a school or 500 feet of another retailer would not be allowed to open there. The city is also considering prohibiting the sale of tobacco products in pharmacies. Here's an example of what this kind of wall of tobacco looks like behind the counter. You see tobacco products on the right, and then there are quit smoking aids on the left. And so it undermines adults who are trying to quit tobacco products by having those visual cues. There are 5 other laws in Santa Clara County to prohibit the sale of tobacco in pharmacies. This would apply to about 7 retailers in Santa Clara, a couple pharmacies, and a few grocery stores that have pharmacies within them. All of these prohibitions would be contained within a tobacco retailer licensing program. Right now, tobacco retailers are required to get a license from the state of California. This would add a requirement to additionally get a local license. The local license is a way to create more comprehensive restrictions than the state law and contain everything in one place related to the sale or marketing of tobacco products. A local license can also allow for meaningful penalties for violators, such as suspending the license, and it becomes self-sustaining. The fees that retailers pay fund enforcement of the Tobacco Control Retailer Licensing Program. As a retailer, you would be required to get an annual license. Violating any tobacco law would be a violation of your license, and so you could be potentially subject to penalties. And there would be, again, this annual fee to cover administration and enforcement. Santa Clara County, the Department of Environmental Health is willing to administer and implement this program if the city adopts a tobacco retailer licensing program that mirrors the county's requirements. The county's fee for retailers is $425. That's what we anticipate would be the fee in Santa Clara. A little bit more detail on the potential penalties. For a first violation, retailers could be subject to up to a 30-day suspension of their license to sell tobacco products and a $100 fine. A second violation could be up to a 90-day suspension or a $200 fine, and a third violation up to a 1-year suspension and a $500 fine. The city staff have done outreach to tobacco retailers, including a mailing with information about this meeting and a survey that the city is hosting. There was also outreach with the Silicon Valley Chamber of Commerce and information provided through social media and e-notifications to the subscribers of the city's news and business resources. As we've said in prior meetings, there is a survey available now, so the city would love to get your feedback. It's through Open Town Hall. Here's the web link. It's going to be open through the end of the month, March 31st. And more information is available on the webpage for santaclaracalifornia.gov, Smoke-Free Santa Clara. There's an overview of the provisions and also Jennifer's contact information if you have any questions that aren't addressed by today's presentation. So that's the end of the presentation. Again, we really welcome your input. Jennifer outlined the ways to ask questions. I'll leave this slide up for just a minute as people get their questions in line.
Great. Thank you, Leslie. So yes, if you are joining us on the Zoom feature on a device, on a mobile device, you may raise your hand or also type in your questions in the question and answer box at the bottom of your screen. If you are on the phone, you may press *9 to raise your hand. Okay, and I see that we have one hand up, and this is Khalil, and you should be able to unmute yourself.
Hello and good morning. Thank you for taking the time for this meeting. I spoke yesterday, and I just want to mention one more thing. Just few points I missed yesterday, which is number one. As I mentioned, I own a business in Santa Clara and El Camino for the last 10 years. The lease I got for that building, when I signed the lease, it was from the ex-mayor of Santa Clara, which is Eddie Souza. And I still have the same building. I still have the same old lease. So that's, from Santa Clara mayor. That's one thing. Second thing, the way how I see it is the fines you just mentioned, which is like, first time, second time, third time, which is max is 500. I think these are too low for business if they're selling for underage. $500 is nothing. It should be harsher fines for any business that's not really, enforcing this. POS system to have a mandatory ID swipe to make sure every tobacco transaction to scan the ID. In my part, I have a huge sign outside my business. No one's under 21. No one under 21 is allowed inside the business. So even I do sell a couple of T-shirts, and underage, they could buy it, but still I don't even allow them to come into the store. I also, that you guys mentioned, or it was mentioned, that 78% in high school increase of vaping product or trying the vaping. I think it's because it's just a new thing. And well, high schoolers back in the days, I don't smoke myself, at least cigarettes, but it's something new. So maybe they seen it as a cooler thing to do than cigarettes, but I don't think it's anything changed. High schoolers, they will do all kind of stuff. And this is all goes back to, how their parents dealing with it. And I think, 21 years is not an over, is not a kid, thinks 18 is old enough, but it's 21. This is the state, this is the law, we're going with it, no problem. And I also I invite some any city, I invite you, and it's any member of the city council to come visit, take a closer look at my business or any other business in the area, and see exactly what we're selling, what we're about to ban. And for the hookahs, there is only one hookah bar in the whole Santa Clara, as far as I know. And I don't think they will survive the whole pandemic now. They're probably out of business. And again, hookah, I'm in my store, the only people who comes, just in conclusion, the only people I see who buys hookahs, and I see an increase in sales hookah tobacco in the last, since the pandemic started, since I see a lot of middle-aged, in their 30s, just like me, Indians, Middle Eastern, all mixture of people who's working from home, and they don't drink. They don't, this is the only thing they do. And it's I don't see no kids are trying to get into the hookah, because it's the whole process. It's a big, oh sorry, but it's a big setup to do. And if your parents didn't know that you're smoking a hookah, I mean,
Thank you. We would appreciate if you could jot down your business name and contact information on the Q&A box, so that we may follow up. So thank you for attending, and thank you for providing your comments. So if you could do that, or you may email me as well. My email is on the city's webpage. But please go ahead and do that, so that we have your contact information. Thank you.
I will do that. Thank you so much. And I'll be more than happy to explain anything for any product. Feel free to come anytime without even giving me a notice. So I'm not prepared at that point. Thank you. Thank you. Thank you.
All right, and so now we will go on to our next member who has their hand up. We have Rojas Communications Group. You should be able to unmute yourself now.
Good morning. Can you hear me?
Yes, we can hear you.
Well, thank you, Jennifer and Leslie. We appreciate this being the third opportunity for business owners to be able to discuss this option before a draft ordinance is written. Myself being and representing retailers with the National Association of Tobacco Outlets, just 4 quick points I want to make. We definitely support the city's view of doing a tobacco retail license, a TRL as it's otherwise known. It's been 10 years that cities have already been doing that, so we support Santa Clara jumping on and doing this. It just adds another layer of code enforcement and education that we all need outside of the FDA as well as the state. My second comment is, I know that it was brought up that the city received for fiscal year 2021 $48,000 in grant money, but the city of Santa Clara received over $200,000 in tobacco sales tax dollars. So we're kind of asking, where's the other 75% of the money going, and only a portion of it going to the city? In addition to that, it was mentioned that there would be a charge for 425 fee that the county instead of the city would want to administer that. So that 75% that's missing on sales tax revenue from tobacco should already be covered. I don't know why the county wants to take even more money from the city. Third, The FDA and state of California compliance checks in the past 4 years, from March 2018 to 21, have only had 2 warning letters. So out of the 65 retailers in city of Santa Clara, 98% have been successfully compliant by in the city. So you have 2 jurisdictions, the state and the feds, supporting that it's not retailers who are selling to youth. And lastly, how much money is going to vape and e-cig education to youth in middle schools and high schools? It was brought up yesterday, but it wasn't discussed. And 2, under that same question, why isn't the school district having their own ordinance? Many people don't know that the city's jurisdiction of ordinance does not include school property. It's a different government agency. So it's a moot point to do these things if the issues are brought up, and I hear it all the time, and rightfully so, from students, that they're smoking in school bathrooms, school property, but the city's jurisdiction is not in the school district's jurisdiction as a separate entity. Why isn't the school district in this discussion? Why isn't the school district doing their own ordinance and being part of this? That's a question that we're all wondering. So we thank you for the opportunity.
Thank you. And I can, thank you for your comments and questions. And to address, so part of our, I'll mention that part of our community outreach process, which we're in now, we have done outreach to the school districts through their communication channels. And so definitely inviting the whole community and every different sectors of the community to be engaged in this process. And we will now go to, we have one more hand up. Ritwan, you should be able to unmute yourself now. Thank you.
Hello, good morning. I just had a quick question. So I tried to go online and see if we can find the root problem of what's causing all of this issues with underage sale. So, and I didn't know exactly where to go with the short time I had. So I went to, I think it's called the FDA.gov, and I went to CTC Compliance and Enforcement. I had tried to enter most businesses in the Santa Clara County, in the Santa Clara County, and I tried to go by city. And I tried to bring out how many businesses that violated, and I didn't find much. So I was trying to find out, if we're going to ban and stop these retailers from selling, then we're not doing a favor to our kids, and therefore we're not solving the problem. I wanted to make sure that if we're going to ban this, then we need to make sure we're doing it right. So my question is if the retailers aren't getting caught for this, or we're not finding out the root problem of where these kids are getting it, then we're just not solving the problem. So therefore, I wanted to find out how many businesses violated and got fined, versus where why we are doing the whole ban. So yeah, that's my point, and I just wanted to make sure we're stopping the actual cause of the root problem of all this, or else we're just wasting our time and making a ban and putting people out of business. Thank you.
Thank you. Thank you for your comment and questions. We have one more individual with their hand up. This is Kelly. You should be able to unmute yourself now.
Hello. Hi, I'm Kelly. I'm speaking on behalf of my boss, who owns a liquor store in Santa Clara. She just wanted me to kind of relate. She couldn't make it, so I'm speaking on behalf of her. And she just wanted to say that this ban would ultimately hurt small businesses in Santa Clara and retailers, and they would lose on like income tax. And especially the point with like, if our city were to pass this ban, people would really easily be able to go to like San Jose or other neighboring cities to purchase these tobacco products, because like San Jose, they allow the sale until like next year, November 2022. So ultimately, like the small business owners would be hurt by this ban, and it's just kind of like not what we should be doing right now, especially with the pandemic, where a lot of small businesses have been greatly affected by it. So we should really try and wait for the state and see, wait until California decides the ban or not. So thank you.
Thank you, Kelly. And I would ask the same if you don't mind jotting down the name of the business that you work for in the Q&A box.
Oh yeah, sure.
Yep.
Sure.
Okay. And we have one more hand up from Stevie. You should be able to unmute yourself now.
Thank you for having me today. My name is Nam Nguyen. I got one question that is really important, and I want to ask you guys. So, why are we trying to ban something that is now illegal for minors to have? It's federal law now is 21. So with that in question, if there's no penalties for these minors, they're never going to stop. So you're just blaming us stores. I am a former smoker, and I'm glad I switched over to vaping because vaping has saved my life. And I want to pass it on my knowledge to my customers. And in return, my customers have thanked me for saving their lives, switching them from cigarettes over to vaping. So I take gratitude in what I do in my business. I'm helping out people getting off of cigarettes. Cigarettes are known to kill people, and it's a proven fact. Vaping has been helpful. Not to say it is proven safe, but it is a better measure than smoking cigarettes. So I pray that you guys make a good decision, not get rid of businesses out there. And yeah, thank you so much for having me.
Thank you. Thank you for your comment. And we now have up next, we have Mark. You should be able to unmute yourself now.
Hi there. Thank you so much for this time. My name is Mike. I'm 35. I'm not a tobacco user. For a couple of months earlier this year, I had the opportunity to get signatures in Santa Clara to delay the California flavored tobacco ban until people are able to actually vote on it themselves. Because of this opportunity, I was able to talk to thousands of people about this issue and many of the business owners. The main consensus from everybody I talked to was that we should wait for voters to decide. Of all the people I want to talk to, I want to focus on what the younger generation said when I talked to them in these stores. Almost every response I got from them was, I don't care about the ban. I will get this product either way. They said they'd get it from different cities. They can go across the city line. They said they'd get it from out of state, from online, which is unregulated product. And then the scariest thing they said was that they would get it from their friends or their dealers on the street. You know, what we're going to do is we're going to make this a black market product, and it's not going to stop the youth from smoking. A lot of the stores that I went to, they already said that they're getting it from their friends, and it's only going to be more unregulated product that is hurting our businesses who are actually carding. If we have an issue with the stores, we should take it up with those stores one by one, instead of, you know, banning all the stores and not letting them sell product, when in other counties you can go to any county and get product. Do you blame Safeways for when kids drink and drive when they card 21 and over? It doesn't make sense to blame the business without trying to get to the main problem, the main focus, which is kids are getting this product from other ways, and it's really hurting our business and our you know, economy in Santa Clara. And there's actually this guy I talked to who said, I have 8 businesses all around the Bay Area and I'm gonna leave. I'm done. I don't want to fight. And he wouldn't call in. And I said, why won't you call in? And he said, there's nothing that we can do to stop this. But there is. You're giving us a chance to, and I appreciate that. And we just really need to understand that the way we're doing this is not the correct way. We could do it better. We need more money for education. We need just to figure it out together and figure out how to help these kids understand that vaping is not the problem, that from the businesses.
you.
I also know people that have been smoking, adults, for many, many years, and after 8 to 10 years they stopped smoking and went to vaping. Vaping is not just this horrible thing. It stops secondhand smoke from cigarettes. It stops the horrible smell. It stops pregnant teens from smoking and all those chemicals when they shouldn't be, even though they shouldn't be vaping. It gives people a second chance, a second option on maybe possibly something healthier that they can do.
Thank you, Mark.
to
I'll ask you to wrap up your comments, please, to allow for time for others to also.
Great. I just
Thank you.
appreciate the time, and yeah, let's just try to think about the best way we can do this.
Thank you. Thank you for your participation. And we have a couple more hands raised. We have Naveed. You should be able to unmute yourself now.
Hi, guys. Thank you for holding this meeting, and thank you for having me on. I'm actually the owner of the hookah lounge, the one and only hookah lounge, which is not closed. Yeah, it's been closed due to the pandemic. And it's been very challenging during this whole year with not being able to stay open, but still remain to pay rent, pay all my utilities in the city, follow every rule and guideline that was given to us. I own the Mediterranean restaurant next door as well. And I've been in the city and had those two businesses since 2005. And for me to read an email coming from you guys really actually was a little disappointing and hurtful, because with everything already being so challenging for a small business owner, and then to throw this into the whole realm actually made it really heartbreaking. And, the first thing that came to my mind was, and I put this in the email, people are going to find other way and sources, as everybody mentioned, that they're going to go outside of the city. They're going to go into the black market. The vaping and the tobacco really isn't the problem. Children are going to find ways no matter what. My question is, what about the alcohol, right? What about the DUIs? What about the universities who's had the biggest challenges with alcohol and the party scene? How is vaping and tobacco even a question when we have such a bigger issue here? Santa Clara University got named one of the, second or third largest party schools. So, I mean, it's, I think, more important for us to look at the overall picture. And this specific, smoking and banning this is actually going to hurt. And actually, you'll see more people using it than you will see less. And that's pretty much I have to say. I appreciate, you guys allowing me and your time. Thank you so much.
Thank you. Thank you. We appreciate your participation and comments. And we will go to our next participant who has their hand raised. We have Mohammed. You should be able to unmute yourself now.
Hello, everyone. Thank you for having me, and thank you for having this meeting. My name is Mohammed. I have a business in Santa Clara. Just responding to one of the comments, like you guys said, 1 in 8 deaths, as I said that yesterday, it's caused by smoking. It's not caused by smoking vapes. It's caused by smoking cigarettes, tobacco in general, which is not flavored. That has been for the past 100 years. And the second thing, you guys mentioned diseases. What diseases are caused by vapes? There are no diseases yet proven that caused by vapes. All of them are happened by cigarettes, and cancer happened by the tobacco, the nectar inside the cigarettes, all the 4,000 chemicals in the cigarette. And also, if the diseases, what about what we can say about alcohol, and also the what happens when you drink alcohol, driving and partying and all that. I really suggest that we wait for the state SB 793, or we would go out of business. And 2020, I paid $20,000 tax, employee tax. And 2019, I paid $29,000 employee tax. So what's going to happen to my employees, my 6 employees? If this ban happened, I'm going to have only like maximum 2 employees, and that's losing for us and losing for the city for the income for the taxes. And if this ban happened, is the city going to give us like our loss, our inventory loss, or what are we gonna do with the inventory? We do community service, we do donations, we support Santa Clara Police Department. The only smoke shops in America support the police department are in Santa Clara, not in any other cities. So I'm with, you know, extra fees, extra licensing, extra penalties. We will pay for it, and by the banning, we will pay for the small business. Will pay for this ban. Thank you so much for having us, and thank you for this meeting.
Thank you for participating. And I will ask if you could please jot down the name of your business on the Q&A box. We would appreciate it. Thank you. Okay, we have a comment on the Q&A. Why not wait for the state ban, because all it going to let people go to other cities and we will lose revenue. Thank you for your comment. And it's 11:38. We have one more hand up. And Myra, you should be able to unmute yourself.
Hi, how are you? Thank you. I called yesterday. I'm with the National Association of Tobacco Outlets. And, you know, I've spent a lot of time in Santa Clara and actually San Jose, because San Jose had the same thing that happened a few weeks ago. And one thing that I do want to make sure to go on record, I really do urge the city council to go and visit the stores and actually put in and do tours, or just drop in for whatever constituents they have in their sectors. They really do need to do their due diligence and really do need to put in the time. I've put in the time, and I tell you, I feel my heart is very heavy to see how this ban on the flavor ban is really going to affect minority owned businesses that have no other ways to make revenue. They're already hurting with the with the pandemic that's given, but just they're highly regulated. The taxes that they pay and the regulations that they endure, and yet they're fine with that. You know, I can see how this is a youth issue. We all agree. I mean, we can all sit here and say, yes, smoking, alcohol, even ice cream, and is not something that is good for us. But what you're talking about now is revenue. Yesterday I had mentioned, I actually have statistics and stats about 7-Elevens in San Francisco have already shut down because 40%, the ones that don't have gasolines, 40% of their business now is gone. These are small business. You know, 7-Eleven is not a corporation. When you're talking about these businesses, we're not talking about corporation. So overall, there's another thing we need to think about. The TRLs, the licensings that they're being heavily regulated, they're all supporting that. They're saying, get rid of the bad apples. They have no problems, maybe put a cap, no more than the 67 licenses that are out there. They're fine with that. But for the city to do this right now, when the state has something in the process for the voters to vote, it's really not the right time for businesses to be put out of business. The retailers have inventory, they have leases, they don't have any other options. They're not, most of them, they're not calling. You know why? Because they feel that if they call and they put their names or they put their address on the Q&A, they're going to get blacklisted, because in the countries that they come from, they got killed for speaking up. That's another thing. So I really do urge that this should not be voted on just this meeting, 3 meetings, that it was really hard for them to call in. Most of them right now are not calling because they're at work. One of them was 7-Eleven, Ray, and I have addresses. He said, Myra, I'm working 18 hours. I only have 1 employee. This is going to put me out of business. I don't have a gasoline. 7-Eleven is not helping. And this is just so sad. Leslie yesterday said, you know, this is not going to put them out of business, but really go visit the stores. Some of these, that's what they have. They have smoke shops. Some of them do not have groceries to sell. But 7-Eleven said that people will not come in now because they don't have the smoke. They're not coming in for anything else. So it is a very sad thing that's happening. I take my job to be a voice very seriously. I've been advocating for small business for 20 years with the Chamber of Commerce. And just my obligation is to right now come and be a voice. We oppose 100% the ban. We support any kind of licensing or any kind of prevention for students. We're saying for the city to just give us more time. The city of Elk Grove tabled it because of these same reasons. The city of Azusa tabled it. But what I'm getting is city of Santa Clara does not care about small business. They don't care about minorities. You know, they're thinking of putting ads on the paper. They're saying there's so much money coming from tech that they're saying, you know, whatever, if they get rid of a few shops, with 65 shops or half of that go out of business, they don't care. But I really do urge the city to care and to make the people that are paying taxes, that are obeying the law, that are, you know, doing a business just like alcohol. I know Gavin Newsom has a winery. I'm sure wine is not on there. So let's support the small business, please. I really urge the city and city council to put in the time to at least visit a few stores before they vote on just a few hours for a livelihood of a business. Thank you.
Thank you for your comments. Okay, I see a couple comments also on the Q&A box that I'll read. Let's ask why weed was legalized. It used to be illegal, but to regulate and make sure that good, safe, quote unquote, good, safe, good products were being used by consumers instead of just getting it on the street. So if we ban flavors, then would it lead to unregulated products on the streets? Do we know for sure if these bans on flavors will help? Education may be the key. The bans will hurt small businesses. We know this for sure. Will businesses close? Maybe not now, but they will eventually. Thank you for your comment. We have another comment in the Q&A box. We lost a lot of business due to the pandemic. More loss will run us out of business. We have leases, we have inventory. Thank you. Thank you for your comment. And we have one more hand raised. Mohammed, you should be able to unmute yourself.
Thank you. I already spoke, but one more comment actually. Yesterday, someone mentioned, I think Leslie mentioned that there are no data that businesses, smoke shops, or businesses carry the vape that will lose. I can assure you that we're gonna lose at least 50%, and you are welcome to come visit us and stay with us. By not banning the vapes in this industry for smoke shop, at least now you have regulated vapes are coming. So we know our sources. The sources are certified from the FDA with the mailing thing, with everything. So there are good sources, and they're not the cheapy ones that you can buy them from Alibaba. So by banning this, everyone will buy from those websites, and very easy to get, very cheap, and they're not regulated and really dangerous. Those are the one dangerous, not ours. Thank you so much.
Thank you for your comment. We have 2 more hands up. Question in the Q&A. Let me go to our next individual, and I want to just note of time. We are at 11:45. The meeting will end promptly at noon, at 12 p.m. And so please keep your questions as specific as possible and comments, and just be mindful of allowing time for others to speak as well. So Vanessa, you are up next, and you should be able to unmute yourself.
Hi, hello. My name is Vanessa. I'm calling on behalf of my Uncle Jay, who owns a small smoke shop in Santa Clara. When he was looking at his inventory, he saw that he's had this business for over 10 years. And 10 years ago, he was selling 1,000 to 2,000 cartons of cigarettes every year. And now he's struggling to sell about 100 cartons. And what he's noticed is that the trend, everyone's progressing to healthier ways by moving towards vape. And I think a misconception is that these smoke shops, that they're selling equal amounts, the same amount of tobacco in normal cigarettes that they did 10 years ago. And now they have this new younger clientele that's selling vapes, but actually they're selling about the same amount, but they're just selling more vapes because people are now looking at the health benefits to vaping versus combustible cigarettes. And he's just noticed that the whole trend is progressing. So if vapes were to get banned, especially like all the flavored electronic e-juices and all that stuff, he says that a majority of his revenue is going to get lost because people just don't smoke combustible cigarettes like they used to. And the majority of the clientele are people who have been smoking for years and they're now looking to quit and go towards healthier options. And he also mentioned that flavors aren't made to entice new users, but if anything, they're to satisfy the existing customers. And he doesn't see that youth smoking is an issue of concern in brick and mortar stores, but mainly that kids, the kids that he sees, well, by kids I mean like teenagers, they'll either come in with their parents or they get it online, but he doesn't get any youth in the store. And when they do, it's easy to card because either the kids will look nervous, and he also has the swipe POS system. So those are the comments he wanted me to mention while he's at work. Thank you.
Thank you, Vanessa. And if you would like, you may also jot down the name of the business in the Q&A portion. Thank you. Okay. So I want to, and we have about 10 minutes left, and I do see that we have hands up from speakers that haven't yet spoken, so we will prioritize those, and if time allows, we will call on others that have already asked a question or raised some comments. So we will go to Paula Baker. You should be able to unmute yourself now.
Hello, thank you so much for allowing me to make a few comments about the business aspect of selling flavored tobacco products. Actually, I understand that, and I talk about this from a couple of standpoints. I was a former teenage smoker. It was very, very difficult for me to quit. I'm well up in age now, and I'm still suffering from health problems that came from that period of time over 30 years ago. Secondly, I also worked very extensively with minority businesses for a number of years of my life in several different states. And last night I heard business people talk about that they were minority-owned businesses. However, this business model is a model that's been created by the tobacco industry, that they subsidize and they go out and recruit people to go into this business. In my former jobs, where I had to certify that people were in fact more than 51% owned and managed by minorities, I don't think this model would stand up to that, because big tobacco has found another way to hook another generation of young people to their deadly products. And they're bringing in minority businesses and business owners to put them in, like they're like it's like a front situation. And in many states, that's very much against the law. I don't know what it is here in California, but you cannot claim to be a minority-owned business unless you have full financial capacity as well as that you're managing it. We know big tobacco educates these people, sends them around to testify at events like this in order to get city councils to think that they're legitimate businesses, but they're not legitimate businesses. I mean, I'm not saying being in business is a problem. I've worked for years to help minority and women-owned businesses be strong and give back to the communities where they exist. But this is not the way to do it. I do hope that we can work with businesses and owners or supposed owners and help them transition to sell much more healthy products. Thank you.
Thank you. We have one more hand raised. Let me check the Q&A box. Khalil, you are up next, and you should be able to unmute yourself.
Hello again. Just a few other points. As the lady she just mentioned about big tobacco being involved. Again, I'm in business for 10 years. This business for 10 years. I have no contract with any big tobacco cigarette company. I am a minority. Okay, I'm half black, half brown, half white, I guess. But this is not the case. But the case is there's no big tobacco doing this for me. Even big tobacco, they're not gonna get any harm from this ban because they're not involved in it. They are the one who's supporting the ban, so they want back. I think they want people to go back and smoke cigarettes. And cigarettes would, the amount of cigarettes I have in my business is less than 5%. I myself hate selling cigarettes. One thing is there is no money in cigarettes other than a lot of taxes, and it's going to to making like about $1 to $10 per carton. So it's not really worth it as a business wise. So big tobacco, at least with me, they're not involved. I haven't seen them, coming in and supporting me in the business or asking me to come. Hey, there's a meeting and you should be there. And one more thing is about my both grandparents, God bless their soul, passed away about 20 years ago. They both died from cancer. One of them, they're both non-smoker at all. And one of them, he used to own a small convenience store, which is, he makes money selling, cigarettes. He could be making more money. That was, overseas, but he would refuse to sell cigarettes. But again, he died of cancer. So this is not something to blame on me. This is, yes, big tobacco issue. This is, something is bigger than, I think city or this is something about state scale enforcement to enforce something against the big tobacco, and they have to pay for it, not the small businesses. And lastly, sorry, just checking my points here.
Thank you, Khalil.
Just let me, okay, thank you.
Thank you.
Thank you.
We have one more hand raised. We have Mo, and you should be able to unmute yourself, and I'll just ask that you be mindful of time. It is 11:54. Thank you. Did you lower your hand, Mo? Okay, I don't see any more hands up. Okay, we have one more, Naveed. You should be able to unmute yourself now.
Sure. I just kind of wanted to reiterate again, and I think the point from the previous comment, not Mo, but the previous person about minority-owned businesses. I mean, we have full control of what we do sell, and we do try to make that right decision. And as mentioned earlier, guys, I think the bigger picture here is there's going to be an alternative source no matter what. Banning us as small minority businesses, small businesses in the city, which is what the city was founded by, and now that bigger corporations are in, is not the way to shut us out, especially after all of these challenges that we already faced throughout the whole year. Just like anything you ban, people find ways to get it no matter what. They're going to find their sources no matter what. We have a bigger problem altogether, and it's not just one, issue, and we do got to take it from a state level. So I think this is something we need to make sure not to hurt small businesses and put them out, right? And then just focus on the bigger ones, because we do pay our taxes. We have been involved. We do help support the police officers. We do help support the fire department. We help support the schools actually as well. We're really involved in terms of that. So to just, say, hey, let's ban all of them and just, close them down is really not the right approach to this.
Thank you. Thank you for your comment. Okay, so now we are at 11:56. I don't see any more hands raised. I want to just thank you all, first of all, for your participation in the business forum this morning. I want to note that the city of Santa Clara, we are currently exploring these policies. They are not currently in effect, and we are taking all of the feedback that we are receiving in these listening sessions and will be all provided to the Santa Clara City Council for consideration. And we will also pull together all of the questions from the listening sessions and try to respond to them as best as we can via a question and answer that will be posted on the City Smoke Free Santa Clara webpage. And so you can stay tuned to receive that as well, to see that on our website. And again, we will take look at the questions gathered and from the 2 community meetings and today's business forum. So again, Leslie, if you don't mind putting up the slide of how folks can give additional input. As Leslie mentioned, we still have the survey up on our website and will be open through March 31st. And so we encourage you, if you haven't already, you may take that survey on our website, and more information and updates throughout the process will be posted on the Santa Clara's webpage at santaclaraca.gov/smoke-free Santa Clara. Again, thank you for your participation. Thank you to the businesses and community members who participated today. And we will now end the meeting. Thank you.